This is Dr. Nelson with Trinity Orthodontics, and I want to talk to you today about a topic that is, I think, very anxiety provoking for patients, and that is doing orthodontic treatment on your young child that still has baby teeth. So we're talking 7, 8, 9, 10-year-old kids, and it's like, why on earth would you do that? Are we
We're
good?
Yeah.
Okay. So technical difficulties with these filming things. So we're trying to get better with each one though. But what I want to talk to you about today, because there's a whole bunch of things that we can talk about, is like with early treatment and why you do it and why you don't do it. And so I want to talk today mainly about palatal expanders. That is the most, besides braces, that is the most commonly used appliance for early treatment. But it's really overused and overprescribed by most orthodontists, in my opinion. So I want to explain to you, by using this, why we would use palatal expanders and why we would not use palatal expanders. Okay, so what a palatal expander is originally designed for is actually widening the upper jaw or the maxilla or the palate, because there's growth sutures that are in the upper jaw that we can actually have control over, and we can actually stretch those out, and we can actually make the roof of the mouth wider. So with the lower jaw, you can't do that. Okay, so the limiting factor in a lot of what we're doing with orthodontic treatment is the lower jaw, not the upper jaw. So when we have a patient that has a narrow upper jaw, how we determine that is by looking at the bite. Okay, so there are a lot of orthodontists that use little measuring devices, and they measure the width of the upper jaw and lower jaw, and they're like, oh my gosh, your upper jaw is too narrow, so we need to put an expander in. And the bites are totally fine. So the upper and lower jaw's widths are matched perfectly. But for some reason, somebody has determined that everybody needs to have a palate that's 38 millimeters or whatever millimeters wide, which makes zero sense, right? Because every patient's mouth is different. People are different sizes, heads are bigger, mouths are big, small, all over the place. So measuring a palate and saying, oh yes, it's not 38 millimeters, we need to make it 38 millimeters, that doesn't even make sense. That's like having a shoe store where all the shoes there are size 10. So everybody has to wear a size 10 shoe, even if you don't have a size 10 foot. So I don't know why that is, but I hear this all the time in orthodontics. It's like, oh, we measured the palate and it's only 34 millimeters. We need to expand 4 millimeters. And I'm like, yeah, but the kid is a little teeny tiny kid. Why? Doesn't make sense. So I want to tell you about stuff that's actual real and science behind it, okay? So I'm going to disappear a little bit. And to see, watch my arrow here. So you can still hear me, but I'm going to go over here and use my mouse. I am going to get a wireless mouse, though, so that we can be on screen. So what a skeletal crossbite looks like is all of the upper teeth on one side of the bite are actually fitting inside of the lower teeth. Okay? And that is because the upper jaw is too narrow. So we go to the other side. See how all of these upper teeth are fitting out over the top of the lower one? This is a normal bite, okay? And then we go back over to this side and see how all the upper ones are fitting inside of the lower ones. This is called a skeletal crossbite, and that is what a palatal expander is used to correct. And maybe I can show you a palatal expander. I didn't actually think about that before I started filming this. Well, anyways, I will show you a palatal expander in my next video. So if you go to the orthodontist and they're saying, oh yeah, little Johnny needs to have his palate widened because I measured it and it's only 34 millimeters, it's supposed to be 38, and they do not have a crossbite, then it's not a very good idea to make his jaw bigger. Okay, so there's only really one instance where making the upper jaw a little bit bigger would be a good idea, and would use a palatal expander for that, and that's if somebody or a child had airway problems. So they couldn't breathe through their nose, or they had sleep apnea, and so we use it for treating that medical problem. But for a dental problem, we always want to look for a crossbite on the back teeth if we're going to be using an expander. If there's not a crossbite on the back teeth, then I would never prescribe an expander for a patient just to make the upper jaw wider, okay? And the reason that I wouldn't is if the upper and lower jaws are the same width and we put an expander in to make the upper jaw wider than the lower jaw, and there's no way we can do that on the lower, we can't put an expander on the bottom, then we've taken a great bite and we've ruined it. I don't get it. So, okay? So, lesson number 1, palatal expanders are for fixing this problem right here, which is a skeletal crossbite. Okay? So, next time I'm going to show you some x-rays, and we'll talk about other things why you would do early treatment based on permanent tooth eruption problems. So, okay? Thanks for watching. If you are wanting a second opinion, or you're just concerned about your child's orthodontic health, then please give us a call at 303-427-5000. And our consults are free of charge, so you're just going to spend some of your time, but you get to meet me, so that'd be worth it. All right, thanks for watching. Have a great day. I'm trying to